is a very straightforward one. It's still going to land into a skilled situation for the dentist. Doing this has to do with the shape of the bone because of the thin facial plate effect. So this one is called, what do I call this one? Facial bone loss. And it's very subtle, but it still adds a little bit of complexity to this implant placement. These are first, well, this is the second, no, they're both first premolar sites, and they're single tooth replacements, and they are within the smile line characteristics here. So let's look a little bit first at the treatment assessment. We are going to give it a green, light green on bone density and bone constriction, and the sinus bone is far away, so we give it a green for that. And the bone characteristics are all green. We give it an orange on facial bone and ridge height. So I'll show you the subtleties when we look at the CT. So let's do that right now, and here we go. So if we're looking at number 5, but let's look at number 6 here. And we're going to see that facial plate being very, very thin here, past the 50% point down the tooth. So down here, it actually is pretty good. It's thin, but not terrible. And as we go posterior to number 4, it looks good here. So, you know, this is what's kind of difficult, is to say really what's going to happen. And this is a first premolar site. But let's look at this bone here. And I'm going to put a line here. Let's look at that. And let's look at the shape. So I'm going to outline the shape here around the second premolar. It's kind of looking like this. So you have a very wide platform. And it's nice and wide here, and it's very wide here, so absolutely no constriction whatsoever here. And let's go into this first premolar site. And you can see the lingual bone stays pretty close to the same profile as the second premolar. And remember, we're just curving around that arch a little bit, not much. We're not at the canine. The canine actually bulges it back out. So you do have your change in the arch as you're coming around the arch, but our lingual bone stays very similar. Our facial bone turns into the canine, but our canine, look at how far out that actual canine bone really should be. It should be very close to this line here for this, where it is lining up with that second premolar. So let's go back to the first premolar site, and let's look at how much that facial plate had been lost when this tooth was extracted. Look at how much. We're almost in the middle of these two lines. That has really sunk it in. It's not really all that noticeable until you really look at that CT. Look at that facial plate. It's completely gone. And look at this now, this shape of this edge here. The problem you're going to face is, and here's where we're looking right here. We're almost right down the middle. Let's go right where we want to be. Should be right about here. So this is what you're looking at. The quality of the bone is good, just that we lost our facial plate because it wasn't grafted initially to maintain as much bone coming out that facial plate, which ends up forcing us, let's put an implant in. Let's just take a 4.2 by 11.5, one of my standards for a premolar, and put it in there. So we still have enough width here, but it does push us a little bit more lingual, and this is why it becomes more of a skilled case, because you definitely want to keep it into a compressive load here if you can, and not be led by this facial bone that's kind of fallen back. So you're going to be putting it a little bit of an angle because you've got no facial bone. You have to come from the lingual side towards the occlusal plane of the lower teeth here on the premolar, so you have more of a compressive load. Here's your problem, is that on the other two teeth, meaning let's say the canine here, look at our profile of our crown is way out here. Let's look at the second premolar is way out here. So where is our implant? It's way in here, meaning it's way more lingual, where your crown is going to have to come out here, and you're going to start to get this problem that patients do not like to see. If you angle your crown where it's more hygienic like this, they won't, because it is a cosmetic area, they won't like to see that look. So here's your decision, or the lab's decision, to help try to figure out, do you want to come out at a sharper angle across the facial so that you come out a little bit more aggressive coming out of this area to help maybe push the tissue a little bit out, and then you get a more proper profile of the tooth so it matches the other adjacent teeth. And that's typically what I do see. So you start to create a little bit of a shelf here. So your contour of your crown gets a little more aggressive than you would like to see. But what else are you going to do? The patient's going to insist on you making it more cosmetic and cares less about the hygienic. So you got to document this, that the patient's okay with that. The other issue you're going to have here is that the lingual side of the crown is going to be coming right here, which is pretty straight. So you're probably going to be putting an angled abutment across this, so it'll go here. So you're going to, as straight as you're going to be, and in a compressive line angle with the tooth opposing it, you're going to probably put a 7 to 10 degree angled abutment to make sure that your crown has enough room to not bulge out on the lingual and actually have more ability to kind of come out on that facial area here. So this is why it becomes a little bit more skilled, not only on the implant placement, but because of the prosthetic. Let's look at the other site on the other side. We've got number 12. And let's see about if the same thing has occurred. So I'm going to just ditch some of these pictures, but it doesn't look too bad. Let's start over on this side. Let's do the same thing. We're going to go on the second premolar. I'm going to put some lines here just like I did before. We'll add it there, and this is the facial profile here. Okay, and so now let's look at the canine. Canine's very close. The lingual profile, it's a little different, but we're right on that facial plane here. Look how thin that bone is. And now let's look at our first premolar here. That's about where we want the implant, right in that area. And once again, we're deficient on the facial side. This looks a little easier to place an implant in this site than on number 5. But nonetheless, you have this kind of more of a pointed edge of bone that you're going to have to start your osteotomy in. But the bone quality is really good. This will definitely be a successful case. It turns out the prosthetic is going to be a little bit trickier than just a regular thing, and you're going to have to play around with that and make sure that the lab understands how they're going to have that contour coming out, and hopefully not too over contoured. It's a very subtle situation with the contouring around the gum line in a cosmetic area such as this, where it will show up if the patient has a higher lip line. So anyway, that's it for this case study. Thanks for joining us on this one. Remember, like us on Facebook and subscribe to us on YouTube, and comment if you like, and please join us on live